everyone, welcome back to my channel. Welcome to Is Pharmacology Difficult podcast, and in this podcast we are going to talk about fast pharmacology, the series where we're gonna cover each and every drug in just 5 minutes. So what is the spotlight drug of today? Today's drug is Miudella, and it is the Intrauterine Copper Device. It was approved earlier this year in 2025, and it's a very nice and important drug. I'm going to tell you all about it in just 5 minutes. So without any delay, let's get started. So Miudella is an intrauterine device. It's a kind of a birth control. It is inserted inside the uterus and it can prevent pregnancy for up to 3 years. It is a copper containing device. It is to be inserted with the help of a healthcare provider. The most important side effects of Miudella can be changes in the menstrual bleeding, painful periods, pelvic back pain or kind of a pelvic discomfort, pain or bleeding during the insertion of Miudella, cramping, low red blood cell levels, that is anemia, vaginal irritation or discharge. These can be the possible side effects of Miudella. Some serious side effects can be severe allergic reactions, breathing problems, wheezing, fast pacing heart rate, swollen lymph nodes, throat problem or pain during swallowing, nausea, vomiting, dizziness, lightheadedness, sometimes fainting, stomach cramps, joint pain, severe infection, some uterine problem. There can be uterine perforation during the placement of the device. Sometimes the poor placement can result in the expulsion of the device and failure of the device. Another serious problem can be pelvic inflammatory disease, PID. If it spreads further, it can affect other organs like ovaries, fallopian tubes, etc. And the bacteria can affect the systemic other organs also. It can result in pain in lower abdomen, chills, fever, heavy bleeding, and a lot of other problems. Precautions can be taken. One should check for the allergies to the patient who is taking this device. The physician and the healthcare provider should check for the pelvic diseases, some kind of problems and infection in the genitals or the pelvic area. If the patient is already having some cancer, the Miudella should not be inserted at all. If there is a problem of Wilson's disease, in which it's a kind of genetic disorder in which the copper builds up, then Miudella is a copper containing device that should not be used at all by that patient. If there is already an IUD or intrauterine device inside the patient, it should be removed first and then the Miudella should be placed. And the patient should be advised, if there is any problem patient faces, she should readily come to the doctor to get rid of the problem. So that was all about Miudella. Time to wind up the session. And this is a short brief information about the intrauterine copper device, Miudella. That is a brand name. Hope you got a lot of information about it in just 5 minutes. That is the fast pharmacology all about. Stay tuned and be ready to listen about another great information about a new drug next time we're gonna cover. Till then, whatever platform you are consuming this episode, do not forget to subscribe. Stay informed, stay curious, stay safe, stay happy, stay enlightened. Thank you.